Good morning. It is February 11th, and this is the Senate Health and Welfare Committee meeting. Today, we're going to look at some of the bills that we've been working on. We're going to start out listening to someone we haven't met before, Sunny Naughton on S197, actually looking at kids and mental health issues and helping us understand some of the work that she's doing. Then we'll hear from John Sales about from the food bank about his work relative to diapers. And then we'll hear some testimony from folks on 195, and then we'll move into our discussion and markup of 194 and 197 and 195. So that's our day. And Sunny, thank you for being here this morning. It's a pleasure to meet you.
Thank you, Ginny. Yes.
So I'll introduce the members of the Senate committee. I'm Senator Ginny Lyons, chair of the committee. Senator Ruth Hardy is the vice chair. Senator Hooker is from Rutland. Senator Ann Cummings, also from Washington County, and then Senator Josh Chiaranzini, our clerk, from Rutland. So we're all here to listen to you and learn a little bit about the work that you're doing with the state and for kids in particular, but your overall, the work that you're doing. So thanks for being here.
Yes, thank you so much for having me. So I just prepared about 5 minutes of information, and I did also share some follow-up materials. So yes, thank you for having me. I'm so thankful to have been introduced to Senator Lyons over the last week or so, the last few weeks, as I've been doing more mental health first aid work in Vermont, which I will talk about briefly today. I always think it's important to share in this new culture we're in, where we're reducing stigma, that I came to this work through personal experience myself. I live with chronic post-traumatic stress disorder from a situation in my late 20s. And so I am actually from the Northeast Kingdom, so I'm a little bit further north than others here, and I grew up here. However, my family is from Boston and New York, and I lived in New York City for 15 years. I was a musical theater actress, and then I worked on Broadway shows with youth and families. So while I came to human services in my 30s, I've always been helping youth and families in my career along the way. So thankfully, due to the virtual nature of business these days, that's happened pretty naturally, I've been able to build a remote consulting company here in Newport. And so I work with youth and family programming across the United States now. However, I do also do as much as I can in Vermont. And I got started when I moved back 7 years ago. I worked for Voc Rehab and more specifically, the Vermont Association of Business, Industry, and Rehabilitation, doing vocational work with youth when that began. And from there, I oversaw a grant, the Regional Prevention Partnerships Grant, through the Department of Health here in the Northeast Kingdom. And that's what introduced me to mental health first aid, which is overall what I'm going to share with you today. I did share some additional materials that go into more details about each training, but I'll give an overarching view now about what we do here in Vermont, and just a little bit about what the trainings are so you understand. So mental health first aid is similar to CPR, and it comes down from the National Council of Behavioral Health out of Washington, D.C. So currently there are 3 programs in the United States. It started in Australia about 20 years ago, and we brought it over in 2008 to the US. And so there's a version of adults helping adults for people who are 18 plus. Then there are adults helping youth, which is for people 18 plus who are working with ages 6 to 17. And then there is now a teen helping teen course, which is for grades 10, 11, and 12. And Vermont is actually a pilot state for that program, which is really amazing. And so Vermont Care Partners is the organization that worked to bring this to the state. And so I work with Simone Ruschemeyer and also Lance Mateer, who was a program manager for this, to bring it to Vermont communities. And so it's truly a course that everyone can benefit from, no matter what their job is, what their skills are, where they live, because it's really about learning empathy and how to just help people advocate to get where they need to be with their health. So specific details are in those materials I shared and are available widely online as well. So over the last 8 years or so, Vermont Care Partners has received national funding from SAMHSA MHAC grants to offer this training cost-free to Vermonters in various forms. So they were able to grant agencies monies, also partner with agencies such as when I was doing the RPP, just for capacity building, because it's really about communications, marketing to get the word out that these trainings are available. This statewide funding from the federal government ran out in the fall. So right now, the Agency of Education is granting funds to Vermont Care Partners, who then work with designated agencies. I am an independent consultant through my company, and we work, and then you go out and you work directly with the schools or the supervisory unions or organizations that are employed or work directly alongside the school to get this training to the staff members. Everyone from janitorial staff, administration staff, teachers, everyone can use this training to think about how they work with youth. So recently, a cohort of trainers began meeting with Vermont Care Partners to determine how many trainers do we still have in the state? Where are they located? What is the capacity? And in the next month or so, we hope to have answers to those questions. So as I mentioned, this training did start with the designated agencies. However, as we are all aware, they have a large caseloads. There's a lot happening right now. So someone such as myself, who doesn't have a direct service caseload, really has a little more flexibility to take, the 4 hours it takes to teach this and the administrative work that goes along with it. And, just this week, I had someone contact me who had taken the training last week and let me know that something that you learn through this training is non-judgmental listening, which sounds like something that we all should do all the time. But there are a few tips and tricks that you can learn that really help you solidify what you're offering the person that you're talking to. So someone contacted me to say that they had a friend that was in crisis. There wasn't anything that person could actually do. They could help. Maybe phone calls had already been made. Their friend really just needed to talk. And she was able to just listen. And she said it was a completely different experience for her. Her friend left the conversation feeling calm and supported, versus maybe continuing to be upset and who knows what would come from that. So in addition to my mental health first aid work, I partner with the Center for Health and Learning, led by Joellen Tarallo, and the Suicide Prevention Center. They have a great program called You Matter, which is about suicide prevention awareness. I also work with Recovery Vermont and Working Fields as a friend to recovery. We really have to think about the parents and the adults and the guardians that are in children's lives. So additionally, I teach COPE through UVM, which is a class for families going through parentage cases. I did get trained as a guardian ad litem, though I chose not to take on cases. And lastly, I'm always piloting empathy programming and after school programs here in the Northeast Kingdom, because that's something I hear from the community that kids are not necessarily learning. So through these experiences, as mentioned, I hear a lot of things. And one thing I wanted to share with you today was, again, just this week, someone contacted me to share with me that their pediatrician suggested that they take their child to the ER in order to get immediate mental health care need although it was not a crisis situation, they were informed that whatever mental health list they were trying to get their child on in their community, it was closed. So they had nowhere to turn to get their child mental health support. And the suggestion was bring them to the ER so they get bumped up the list. And for so many reasons, we understand that is not really the best way to go. So I've come to these things just because I'm a creative problem solver. Essentially I grew up as an artist, and it's wonderful to be able to do these things in Vermont, which is a leader in public health. And so it's, as we all here understand, it's really important that we focus on these topics for youth and young adults. So, I have a lot of different ideas of things we can do. And I'm so excited to have begun the conversation with all of you today.
Sunny, I don't know where you get the time to do everything that you do. It's amazing. Thank you. Thanks for sharing. So you've given us some information on our webpage, which will be very helpful. But can you help us understand just a little bit how you do all the training? Do you have others who do some of the training? How does that all?
So mental health first aid specifically?
Yeah.
Yeah. So how mental health first aid in Vermont works is there are trainers at most every designated agency, and then a handful of community partners that align with prevention. So I am one part of a larger program that, as I mentioned, Vermont Care Partners and interested trainers are kind of seeing what's going on now. So the hope would be that moving forward, there would be one person, one phone number, as we've had in the past when there's been a grant coordinator that organizations can contact, and then from there be matched up with a trainer. So I train organizations that come to me through my network, or that other trainers send my way. And then conversely, if I find out that there's a need in St. Albans, or there's a need in Rutland, I'll try to partner them with someone that's local. However, if for whatever reason scheduling that's not available, then I seem to have a lot of flexibility, because obviously I run my own schedule, my own programming. So at one point in time, there were potentially 50 to 100 trainers in Vermont, and we're just not sure where that number is at right now with recertifications, etc.
Okay. So what if any link do you have with the Department of Mental Health?
Sure. So that would be, I do work with Center for Health and Learning, as mentioned. And so I don't have a direct link with them, but some of the, the You Matter work, I believe they support. And I'm not clear on the history of the Department of Mental Health and mental health first aid. So I couldn't speak to that knowledgeably.
Okay. Thank you. That's helpful. Questions, committee, for Sunny? Yeah, go ahead, Senator Hardy, and then Senator Hooker.
Thank you, Madam Chair. And thank you, Sunny, for introducing us to this program. I'm looking at what you provided and also trying to listen at the same time. So, the program trains teachers, et cetera, school staff to be able to provide mental health first aid to students. Is that the basic nutshell?
Yes. So it's basically the way we think about CPR. Mental health first aid provides a five-step process that essentially anyone could practice with another adult, but there's one that's specific to adults helping youth.
ALGE, right?
Yeah.
I see it.
Yeah, we like ALGE.
So is there also an element of peer-to-peer?
Yes. So how it works is there's 3 programs right now in Vermont. So there's adults helping other adults, adults helping youth, which is the youth mental health first aid. And then Vermont is a pilot in teen helping teen. And that's
I thought I heard that. Okay.
Yeah.
That's where you take a group of other, there's different ways that can be presented, but a group of 10th graders, 11th graders, 12th graders, sometimes in Vermont, it's mixed, obviously, and they learn a version of ALGE that's appropriate and safe for a teenager.
Okay. And it's through Vermont Care Partners, and the designated agencies are involved with it as well.
I mean, that's the setup here in Vermont, but around the country, there are some states where everyone's an independent instructor. Vermont is very lucky to have the state and the nonprofit support.
The coordination. So let me just try to understand. I know you're coming in to just tell us about the program, but is there maybe this is an obvious question, but is there a need for us to do something to better support the program so more people can take the training and more people can provide the support? Or do you have an ask for us?
So I actually don't, other than just bringing information to whoever I can to know about the program.
Okay.
I think the historically Vermont Care Partners and Simone Ruschemeyer have led this charge in Vermont, and now that more people are interested in it, there's a chance for it to diversify. Which is what we talked about in our cohort meeting this week. So there may be an ask from another organization. I just wanted your time to share.
Oh yeah, that's totally fine. And is it for, students are in a crisis at a moment, but what about, and I understand that sort of, like delivering mental health CPR, as you said, but what about the sort of like just ongoing daily stress and anxiety of going to school right now?
So actually, this program is designed as a prevention or intervention program. So what it does is it takes you through how to notice the signs and symptoms of an oncoming mental health difficulty so that hopefully we don't get to crisis. And then a part of the training talks about what you would do if you come across someone that is in acute crisis. So it's sort of both.
It's sort of both. Okay. Do you know how many schools have participated in it?
Well, I couldn't give you the specific number for the whole state. I'm sure Vermont Care Partners and the Agency of Education can. I can say that in my time in Vermont, I have trained over 800 people in the last 4 years. And in the last 6 months, thanks to the Agency of Education funding, I've held 6 or more trainings, so about 1 a month. And they're anywhere from 15 to 30 people.
Okay. Wow. That's great. All right. Thanks.
Yeah, thank you.
It sounds terrific. Absolutely. Senator Hooker.
Thank you. And Senator Hardy sort of had some of my questions answered, but one question, Sunny, is you talked about certification. So is it different agencies like the Agency of Education that would be certifying these trainers? And do it's not just one place that the certification comes from? Is that what I'm understanding?
Actually, let me clarify that. So the training comes down from a national organization out of DC. So when you, it costs around $2,000 to become a trainer, which many of the grant funds have provided to Vermont trainers. I don't believe anyone in Vermont, as far as I know, ever had to pay for themselves to become a trainer, which is wonderful. So you receive your certification through this agency in DC, and they oversee your certification. So you work directly with them. In Vermont, Vermont Care Partners brought everyone together and supports ensuring that you have to do 3 trainings a year to get your recertification. So ensuring that people have opportunity, they have what they need to continue training. Some people just do this as a part of their, full-time other job. So they're not going out every day and saying, hey, let's do more trainings. It's a passion of mine. So I am always talking about it. However, it can be a struggle for some people to do 3 trainings a year to keep their certification. So in Vermont, it's really funding and capacity that we receive, and our certification comes from the national office.
Okay. And another question, you talked about the person who was told to bring their child to the ER because other agencies were closed. Is that physically closed? Is it closed because they have no capacity to help?
Sure. So it was capacity. And I don't know what agency it was, so I don't want to go on record that it was a DA. It was a parent came to me and asked me, what other supports can you suggest for my child? And I get this question a lot, and I'm not a provider. However, I work with NAMI, and I'm happy to see that Lori will be here today. I just try to creatively find places that parents can talk to about their youth while they're either on a 6-month waiting list or a waiting list is closed.
Thank you.
Go ahead, Senator Hardy.
I always have lots of questions. I'm that committee member. Do you have data about the efficacy of the program? Like how many kids it's helped or adults?
Absolutely. We can pull this data for Vermont specifically or on a national level. So I don't have it in front of me right now, but we can certainly provide you with whatever you'd be interested in. Yes.
You know,
I
I think
mean, I mostly would be interested
Right.
if we're going to do something more for the program. I want to make sure that it's, I mean, it sounds great, but I'd like to see more data if
Absolutely.
Yeah.
It's evidence-based, and the National Council specifically has all different data points for, I just had, a university in Connecticut wanted to know about if people feel less lonely after they take it. So we were able to pull that from the National Council, although Vermont Care Partners and any grant that's worked on it in Vermont has taken a very close look at everything. So that is absolutely available.
Great. Thanks.
Yeah, that would be great if we could see that some of the data. It's probably a criteria to get the grant in the first place is to so that would be useful. All right, thank you.
Yeah, thank you all.
Well, listen, thank you for the work that you're doing for all of us. It is exciting to hear about. It's something new for this committee, and we greatly appreciate your time, and keep up the good work.
Thank you all. I appreciate your time as well, and stay warm. Enjoy the sunshine we have today.
We're going to try and get out there.
Bye-bye.
Thank you, Sunny. Okay. So we'll move on to John Sales. That was neat. John, welcome. You're muted. Now you're not, I think. Did you unmute?
I am.
Okay, terrific. So John, we don't need a lot of testimony, but I know you, I asked you to think about the diaper working group bill and the role that food bank is playing, and maybe you could help us understand what works going forward. I think that's really where we are. Great.
I'm happy to do that. For the record, I'm John Sales, CEO of the Vermont Food Bank. Thanks, committee members, for having me this morning. Just as far as the food bank and diapers, I'll just give you a quick rundown of kind of what we do, what I think we can do, and what I can see as a path or a way to take a path forward. First, the food bank does distribute some diapers when we get them donated. We don't have a diaper program, and we don't actively source diapers. So we're not out asking for diaper donations like the diaper bank does. And when we have them, they go on. We have like what we call the shopping list, which is basically an online list of what's in inventory, and our network partners, the food shelves, the meal sites, and other places can order what's in inventory during their ordering window. We usually deliver once a month to our partners. We've been working with Amanda and the diaper bank really since soon after they started, giving technical advice, warehousing stuff, some distribution advice, and actually storing some of their diapers when they have more than they can fit in their facility, which is quite small. So we've been partnering all along and are really familiar with what they do. And I really understand, having been on this journey in some ways with them, that this is growing way too fast to be sustainable currently, the way the diaper bank is doing it with 100% volunteers. I know that we do acquisition and distribution of products. It takes a lot of time, and it's very complex work. So we really need to figure out kind of what's the next step. How are we going to do this in Vermont in a way that's going to be able to continue to move forward. So as far as the food bank, it's not just a matter of, the food bank can then now add diapers to our shopping list and start sourcing diapers. as I said, we do some of that, but diapers are a different product. They're very bulky, take a lot of storage space. It would take a lot of space on our delivery trucks. And the fact is that we're not necessarily going to all the places where the diapers need to go already. So it would likely mean new routes and new partners. And an example, so the food bank, a donor who's very interested in the issue of period poverty, we were working with and wanted to try a menstrual product pilot. And so we said yes. And the donor funded the purchase of the products. And it turned out, we thought, oh, well, we'll just go out and find a source and buy a bunch of menstrual products and put them on a shopping list. And it just has not been that easy. Just even finding a supplier for the products was surprisingly challenging. Someone who would give us, commercial quantities of pads and tampons. It was hard. And now now we're cultivating some new partnerships, like with Planned Parenthood for distribution and schools. And so it's new routes, and menstrual products are, it's a different product, much less bulky than diapers. So if we were doing this at the scale we're doing with menstrual products with diapers, it's talking about adding trucks, adding drivers, adding routes. So it just is a little more complicated. Ideally, from my point of view, just like food, the solution is that families have the resources they need to get the things that they need in their homes. So in, 3 Squares, Vermont, you can't use that to buy any non-food products. So, one way to address this would be have people be able to buy, things like diapers and menstrual products with 3 Squares Vermont benefits. Of course, that's a national issue. I know the House just passed a $1,200 child tax credit bill. The feds for about 6 or 8 months had an enhanced child tax credit. That kind of program, which gets the resources directly to the families, really makes a difference. And I think that, that is one of the solutions, programs like that. That said, things like sourcing the donated diapers and making sure that they get distributed to the places that they need to go is part of the puzzle. And I think that all the stakeholders should be able to sit down and talk about this and figure it out. And that's another thing, the food bank, we're not engaged with all the folks who would be stakeholders in the diaper conversation right now. So we would have to understand what the needs are in the community for the folks like the daycares and the Head Start programs. And, a lot of the parent-child centers are food bank partners now, but there are a lot of other parties that aren't necessarily in the food bank's orbit that need to be part of this conversation. But the food bank, I think, can bring something to this conversation. We certainly have experience with, sourcing and distribution and logistics, and that's a big part of getting a product like diapers out to where they need to be. Also, I'll end with the state needs to play a leadership role here. DCF is a key partner. A lot of the folks that are getting access to diapers through their diaper banks are people who are already part of lots of programs like 3 Squares Vermont, like the parent-child centers, like WIC. Having a diaper benefit on a WIC card would certainly go a long way to getting folks who are having trouble accessing diapers. So DCF needs to be at the table and an active participant in helping figure out the solution. I would say in the short term, last year, I think it was CARES Act funds, and the legislature allocated some funds to the diaper bank. And because the diaper bank's a small organization, we didn't necessarily want them to have to negotiate a grant agreement with DCF, which is a really involved process. The food bank was kind of the sub-grantor for those funds, and we'd be happy to play that role again. I know there's there's 6 million in the budget adjustment for the food bank, and a lot of that is going to be going out again in grants to community organizations. So we have the function in place to be able to do that. And the food bank will be a participant in any kind of community efforts as we get all the stakeholders together to figure out, how we keep the diapers flowing the way they need to flow. And as far as funding to make that process work, the food bank would be happy to be a conduit for that also. I'll leave it there and be happy to answer any questions you have.
Okay. One question that maybe would help is we have a bill in front of us that has a pretty powerful working group to do this. And are you suggesting that we need to have that working group, or is it something that can happen administratively?
So, as someone who worked for state government for
Yes.
10 years and spent a lot of time in the legislature, and it was part of a lot of legislatively created working groups, I really think that the community, the stakeholder community, can do this without the need for a working group. I know there probably are other points of view, but sometimes I think having legislation around something can slow the process down as opposed to helping move it forward. That would just be my 2 cents there.
Thank you. And then I think that this committee's been traveling in that direction. So the other question is, so in terms of the money, the current $6 million appropriation that the food bank has would not cover the diaper grants at this point. You're suggesting that we would continue with what we did the last time, at least to cover the purchase and
yeah, I think if it's a small amount for facilitating a process of stakeholders, certainly the money that's already in the bill for the food bank. But as far as if it wants to go towards kind of the next year of operating the diaper bank, I think having something dedicated and directed toward the diaper bank would be helpful.
So were you suggesting that you would bring together stakeholders?
I'd be happy to be part of that process. And
okay, that's good to know. Yeah.
Absolutely.
Okay. Yes, that's helpful. And then
I don't think we're appropriate to be basically even the lead, but certainly I can start nudging things in a direction and making sure that people are talking.
Terrific. Thank you. Questions, committee? I tried to ask the questions I thought were on our minds when we brought John in, but if you have other questions, it would be helpful. Go ahead, Ruth. Senator Hardy.
Yeah, no more. John, thank you. I'm so relieved that you said you don't think we need that task force, because it just seemed like overkill to me. I mean, you all know each other. I mean, obviously you don't know all the individual players, but it seems to me that you and the diaper bank are well positioned to be able to come together and help start a process to figure this out. And obviously somebody from DCF or AHS needs to be involved. And I'm sure the parent-child centers would come to the table, and the, Building Bright Futures and the childcare providers as well. So if you can just make that happen, I would be super grateful.
I can't promise to make
somebody
it happen.
will make it happen.
Well,
I can certainly
if you need help, John, after the legislative session, if you can't get people, just call me and I will get them there for you as well. I mean, I really mean that, because I just think us creating a task force is silly, and you can, if you get it going and you need any help nudging people, I'm happy to do that.
No, I hear you. Thank
okay,
you.
great. And I'm saying that on the record.
Okay, get ready to travel, Senator.
I can't wait to travel. I really can't wait.
Even a trip to Montpelier would be like a vacation.
Exactly. Right. I need to get out of this room.
Other questions for John? John, thank you. I know as you're talking through, and one of the things that we have to do when the budget comes along is to make recommendations on funding. So if we do continue the funding for diapers, which I think is probably a good idea, we might put in there a request that somebody from DCF stay involved with the decision making. That would help. But having the all-powerful working group probably, I know there are others who disagree with this perspective, but it doesn't seem like it's needed at this point. Senator Hooker.
Thank you. And I would just like to suggest that something happen quickly, because it seems as if the diaper bank people, the volunteers who have been so dedicated to this, are really searching for a way to move this along and to make sure that it's going along, in the future, going to be sustainable. And I would hope that this could be done quickly.
Yeah, thank you, Senator Hooker. And Amanda and I have been talking a lot lately. And so I know that the folks at the diaper bank and others who are stakeholders here are anxious to get something rolling. And in order to, have a solution before the diaper bank kind of, gets way too big for what it's able to do, I think we do need to get started working on this right away.
Yeah, there's a whole lot of stuff mixed in with this one. It's everything from workforce and economy to pandemic, but the leftovers of the pandemic are going to be significant. So, and you see that probably more than anybody.
Yeah, absolutely.
Thank you, Senator Hardy.
Yeah,
last
one other thought, Madam Chair. It might be I don't know if it would be helpful, but it might be satisfying if if our committee wrote a letter to our congressional delegation asking if they could work to have diapers, menstrual products, and also I'm going to get the word wrong, the adult depends type pads.
Diapers, adult diapers, and
adult diapers.
Yeah.
I don't know if that's the
Yeah,
correct
well,
term, but those things added to the 3 Squares Vermont eligibility, they are, obviously essential products for various stages in everybody's lives. And it would be, I think, if we could go on record saying, hey, that would be really, really helpful and help solve at least a piece of this problem, that would be nice. So I don't know, Katie's on here.
Katie's listening. That's a great suggestion.
For us.
Great suggestion.
It might make us feel like we're doing something, even if it doesn't happen. But
I think something like that is valuable. There is a federal bill on diaper access. Representative DeLauro of Connecticut. If you look at the National Diaper Bank Network's website, they talk about it there. So there are some action going on, and I think state legislatures weighing in is very helpful.
Great. Yeah, I think it would make me feel better too, like we're doing something.
Yeah, that's a great idea. So Katie, can we get a draft sometime?
Yes, you can get a draft,
Okay.
and I'll work with Rosa to put something together.
Oh, good. Yes, it is her bill. Yes, please. Yeah.
Thank you.
Okay. Anything else? Any creative ideas? I think we're good. Thank you very much. This has been very helpful.
You're
Appreciate
welcome.
it.
You're welcome. Happy to be here.
Thank you, John.
All right. So we'll try to get my iPad working again. And Aaron, we've got 2 more folks coming in.
Hey, Ginny, just while or Senator Lyons, sorry, I know we're still
Oh, it's okay.
thinking of it. You had asked about witnesses for bills, and I wanted to have Lauren Hibbert come in on the bill
Right.
about you know what I'm talking about.
654. 654.
No,
No?
is it 195, the certification, the one we're doing right now, just to have her look at the
Comment.
language.
Okay.
Yes,
Yeah, Aaron, can you remind me that we should do that? And we'll try and find a time next week. I'm thinking it may be possible to get her in on Tuesday. I know we have 2 people on Tuesday, depending on what the floor is like. So we'll do that.
Great, thanks.
Okay. All right. Thank you for being patient with us this morning. It is a pleasure to have you both here. And we're going to, we've been taking testimony and listening about the certification for mental health peer support, as well as the coordinated mental health crisis response working group for, not that one as well, but looking at how we can coordinate some of our mental health services. And then also looking at peer operated respite centers. And I know you're both experts in the area. Now you're here specifically to talk about 195, or do you have comments about the other two? And that's just a general question, and you can let us know as you go along. But Lori, welcome. And Sandy, welcome. It's terrific to have you both here. The issues that we're talking about are so overwhelming today, and we're looking for solutions to the problems in front of us. So you're testifying separately. So Lori, why don't you introduce yourself for the record? And we do have your written testimony. I think we have to refresh our page, committee, to get it. Aaron sent me a little note. So refresh your page, and then you'll have both sets. So Lori, welcome.
Okay. Well, thank you, Madam Chair, and also the Senate Health and Welfare Committee members for allowing us to be here today. For the record, my name is Lori Emerson. I'm the Executive Director at the National Alliance on Mental Illness of Vermont. And I want to thank you for allowing us to provide comment on Bill S-195 today. And we would also like to provide some comment on Bill S-197, Madam Chair, if you have time.
No, that's fine.
Okay, great. So NAMI Vermont supports establishing a certification program for mental health peer support specialists. And we really appreciate the committee's dedication and commitment to peer support, especially in this time of workforce shortages, service gaps, the increasing mental health crisis, especially with youth and children today. And the state of Vermont is really far behind the nation with establishing this program. So we really applaud your work right out of the gate with this legislative session to address this. And there are references in the bill to establish a there are references in the bill in regards to family members being able to be certified. However, for us, it really wasn't clear that the bill was to establish a family-to-family peer support specialist certification program, and until Wilda really clarified that on January 26th with her testimony. And we really appreciate that inclusiveness to also set up a family-to-family or parent-to-parent certification pathway. And, just to kind of review, the family-to-family peer support specialist or a parent-to-parent peer support specialist, they have the opportunity to really impact families through support, education, and the family or parent peer support specialists draw on their own experience as a parent or primary caregiver of either an adult or a child with an emotional or mental health needs. And they work to empower families by teaching skills that assist them in finding their own voice and to advocate. And they have current knowledge of the mental health system, and most importantly, recognize the life experience of raising a child with a mental health diagnosis or supporting an adult family member who has mental health needs as well. And family or parent peer support specialists provide a variety of services to families. And these include sharing expertise by providing information, teaching coping skills, providing emotional support, and helping parents become advocates. family or a peer support specialist may help families navigate and understand not only the mental health system of care, but the educational systems too. And they may accompany parents to meetings to ensure that the parents' voices are heard and they are able to assist families by modeling good communication skills and sharing their own experiences. So there are 3 organizations that are really grounded in family peer support, education, and advocacy. And that's NAMI Vermont, the Vermont Family Network, and the Vermont Federation for Children's Mental Health. And the legislation as written focuses on mental health peer support specialists, but does not consider the differences with requirements or competencies and trainings for a family-to-family or parent-to-parent support specialist. And all 3 are really unique in their own respect, and that the certifying entity, we feel, needs more than feedback and recommendations from the family organizations in this process. You know, we are the Vermont statewide family education support and advocacy organizations and really want to be more involved with that process. So I'd also like to comment on Bill S-197, an act relating to the Coordinated Mental Health Crisis Response Working Group. And we really appreciate the opportunity in being named in the legislation to be part of this working group. And the NAMI Vermont Advocacy Committee has been working on a project for family members recently, and we're collecting information from the designated agencies about their crisis intervention process. And really our objective with doing this was to share information with families to educate them about the options to help support their family member instead of calling 911 or bringing them to the emergency room when the crisis is just so acute that there are no other options. You know, we really need to intervene early. And we've been doing a lot of this research, so we want to help family members know these different options so that they can make that right choice and intervene before it gets to that crisis level. And I've also been on the Department of Mental Health Coalition to establish the 988 3-digit suicide prevention lifeline at the state level. And NAMI National had advocated at the federal level when this legislation was passed nationally. And they're now providing guidance to many of the state organizations for our advocacy efforts with this. And that guidance is really to reimagine crisis intervention. You know, we should no longer be calling 911 or taking our loved one to the emergency department. You know, this needs to originate in the community. And this approach has 3 pillars that I wanted to talk about. We need someone to call. We need call center hubs. This is where crisis calls originate with 988. And sometimes the caller just needs someone to talk to. But if not, and they need more support, then what do? They need someone to respond where there are mobile crisis teams, to meet people where they are at, to help with that de-escalation, and provide resources to individuals and families as well. But then again, what if they need more of an intervention? They need somewhere to go. So establishing more crisis stabilization throughout the state, and that includes short-term stabilization for children and adults, such as the Psychiatric Urgent Care for Kids, the PUC model with United Counseling Services. And they're working directly with schools. We're also lacking an adult 24-hour crisis stabilization center in communities throughout Vermont. And some designated agencies have crisis beds, but it's not a drop-in center for crisis stabilization. Having more peer-operated respite centers is also another great option, and we support that bill too. So if someone needs inpatient hospitalization, what is the continuum of care? And this is where we hear from family members that when they get discharged from the hospital, there isn't that step down option to ensure they're able to care for themselves. And we hear from families and individuals that they need more support. Now, of course, all of these options aren't possible until we address the workforce issue. So thank you so much for listening to our comments and the committee's commitment to establish a pathway for mental health peer certification programs in Vermont for both peers and families.
Thank you. That's very helpful. And it's very helpful to have your testimony in writing so we can go through and digest it a little bit more, reflect on it. Overall, what I'm hearing you say is that you want to stay engaged with the process. And you also, I'm hearing that you are also interested in having the Vermont Family Network continue to be a part of the process.
Yes.
And
Pam wasn't here to testify today.
That's okay. Yeah. I'm very familiar with their work. I was on their board for many years. Then the other question I have for you is, as you're thinking through, you are supportive of the legislation before us, but you've asked for some modifications to ensure and to make sure that family to family support is included within this. Have you done any thinking at all with the peer support, peer-to-peer kids or children's? I know you've talked about children's, but how would you see the children fitting into this? I know we need step-down beds. I know we need to keep them out of the ED. I know that prevention and prevention is so key, and having some intervention that smooths things over, at least for temporarily. What are your suggestions for kids specifically? Do you have any that would help us?
In regards to the parent-to-parent support system, or the respite system, or a continuum of care?
Yes, I'll start with the continuum of care and the respite system. How do we build a system for kids? I know when I think of the Ronald McDonald House that we have, where families can go when children are in the hospital. Do we have a place? And theoretically, we have step-down beds, but Brattleboro isn't exactly functional right now. So.
Right. There are many options as we look at that continuum of care, and I definitely want to hear from Sandy as well with her thoughts. The Vermont Family Network and the Federation work directly with the parents and children in that respect. But what we are hearing is there is that lack of those services. Now, there could be these services in place, but we don't have the staff to support it. Now, there is some programs I know that Sandy, the Federation, has, and the Vermont Family Network has, in supporting families with that peer-to-peer support. And, NAMI Vermont also has many programs. We have educational programs, such as our family to family class, where we give families the education about mental illness, the coping skills, as well as crisis planning, and having that peer-to-peer support model with our support groups as well gives people the support so that you're able to talk with other people who've been there and they understand. So being able to continue to keep doing that work. We're also in conversations with some of the hospitals to establish a Friends in the Lobby program, not only for family members, for parents, to be able to help support them. Let them know that other families are here for you, that, we understand. So peer support is critical, I think, in being able to help families and youth. And our programs are grassroots organized from, and we've been doing this since the 80s. So, you know, we're very well established and can provide that peer support, but yet also addressing the clinical needs as well and helping families with those clinical needs and having the workforce to do what needs to get done. But early intervention is important, you know, as well as, you know, from my own personal experience as a family member, what was helpful for me was having that educational component. Going to an alternative school that was therapeutic really helped my family be able to cope with those emotional needs that they had. So I highly recommend also bringing in the Department of Education in this process. How do we make this more therapeutic for kids in schools? And it's not, you know, we've really got to rethink education and how kids are getting support there, because they're there for a good 6 hours of the day.
And thank you for that last comment. And we'll probably move along, but we are working, I am working with the chair of Education Committee and others on the about that last comment. So we can
Excellent.
engage. Yeah, it has to be, there needs to be that bridge, you know, between family and community. Schools are critically important. So. And obviously the after school program that you may or may not be familiar with is doing great work. So, okay.
Absolutely. Thank you,
Good.
Chair.
All right. We've got two questions for you. And so Senator Hardy and then Senator Hooker.
I'll defer to Cheryl. It's her bill. Go ahead.
Okay, thank you. Lori, you talked about family to family and parent to parent certification within the bill. Do you have language that you would like to see incorporated into the bill to make sure that those special certifications, I'm understanding that you think that there's a need for some kind of focus perhaps on that type of peer support, and I'm wondering if you need language in the bill to affect that.
You know, I really appreciate the intent of the bill to establish the certification process. I think it's just understanding that there are, you know, very, very different requirements, possibly in the training or competencies, whether it be a peer-to-peer model, a family-to-family model, and a parent-to-parent model. And, you know, I don't have suggestions right now about changing any language in the bill, but I think that, you know, that there needs to be more involvement from the family members as opposed to meeting with four meetings to provide feedback. You know, I see establishing the certification process is definitely needed, but there are just differences in each of those groupings.
Will you consider providing us with some language as Senator Hooker has suggested?
Yes, I will meet with Sandy and Pam as well.
Good.
And
Okay.
we will provide that. Thank you.
Yes, that would be very helpful. Thank you. Senator Hardy.
That was my question. Thank you.
Good. See, we're all on the same page. This is great.
Yes, thank you very much.
No, it's great. And say hi to Pam for me, please. It'd be great from all of us. I think we're all appreciative of the work that she's doing as well. Sandy, welcome. It's a pleasure to have you here. And we do have your testimony. So if you could please introduce yourself for the record, and then we will listen to your testimony.
Good morning. For the record, my name is Sandy Yendo. I am the Executive Director of the Vermont Federation of Families Children's Mental Health. And I am going to refer a lot to my written testimony because this is subject matter that I've been involved with since 1988. I'm very passionate about it. I get very emotional about the state of children's mental health in 2022 after being involved since 1988, and have many, many comments that could take days. So my number's on there. I'm happy 24/7 to comment. But as the executive director, my hope is to convey today that we have been longstanding supporters of peer certification and funded peer support. And, we really appreciate the invitation to briefly share some of our involvement and insights as peer support boots on the ground. We are one of the first chapters established under the umbrella of the National Federation of Families for Children's Mental Health 32 years ago. We have been providing statewide peer support for families impacted by children's mental health, emotional, behavioral concerns since our incorporation. We do this thanks to federal funding, designated the Federation as the statewide family network for children's mental health needs. We're often asked, what is the difference between the Federation and VFN, which is much larger? And VFN, as you know from being on the board, Senator Lyons, is a family-to-family, peer-to-peer that is evolved out of federally funded designated line items in the Medicaid budget, where children's mental health, when that was done, was ignored. And so under that designation that VFN has, they have been, their focus has been on children with special health needs. And as we know, that, spans a gamut, and it's huge. A decade ago, the National Federation of Families for Children's Mental Health finalized the in-depth and complex process to credential peer support specialists for families impacted by children's mental health and adolescent substance abuse. As one of the subject matter experts appointed by the Vermont Department of Health, to be a part of what was a 3-year rigorous process. I have firsthand knowledge and I think some trauma involved in that process, because creating a credentialing exam across children's mental health with all the competencies, the trainings needed, the code of ethics, the different tasks involved, the scope is 3 years wasn't enough, but they did roll out the first exam, and for over a decade have been working on that process. In my testimony, you'll see a link to the 32-page certified family peer specialist candidate handbook of all that someone who has been doing peer support can apply to become a certified peer specialist. While S195 does not mention children's mental health specifically, it does include the family-to-family peer certification. Lori's already covered some of the differences, the fact that our individual and collective missions are different. Peer support in multi-generational populations have some common elements and expectations, but the way we respond to a family with spina bifida or diabetes is much different than mental health. And so we are very clear at the Federation that when a family comes through our door, that there is no involvement currently with mental health and no life circumstances at the current time that puts them at risk, that we refer over to the Vermont Family Network, because it is not our goal in any way, shape, or form to duplicate services between family support organizations. We all have plenty to do in our own lanes, and our subject matter expertise is built in our lane. Since 2012, the National Federation of Families, Children's Mental Health has been the Federation's certifying body. That is where we go and how we train and what we follow and what we have built our core around. I don't want to suggest in any way, shape, or form that we have a deep pocket of certified peer support specialists in children's mental health, because it takes a whole lot more to make that happen than just having the opportunity to get certified. We need funding. Peer support, we know in Vermont, it's not well funded. It is certainly not funded at the Federation. We do family support in this population thanks solely to a federal grant, not state monies, to do peer support, even though we have recognized since 1988 how valuable and necessary peer support is, which goes all the way back for me to Act 264 and the creation of coordinated services plans that involved education and mental health and child welfare, and is still not where we would hope it would be after 32 years, which plays in a little bit to S197, which I'm not going to comment on, but what we've been talking about in the Mental Health Integration Committee is that we have a lot of existing things in Vermont that have not been built to scale. What is available for me as a resident of Addison County is not necessarily what's available to a family in resource-rich Chittenden County. And to learn as I've only been sitting in the executive director chair here at VFF for 2 years since COVID hit. My 3-week stint turned into 2 years, but that's a whole nother story. But I won't go there, but looking at what we already have, we're not doing that. In this crisis situation, we're not looking at what we already have and the legislation that we have that should be guided. Are there places where legislation needs to be tweaked? When we talk about children in the emergency room, there is so much that we can do because we aren't built to scale. Learning last year during the legislative session that Bennington County had PUC and that it was so successful in Bennington County. We're going, okay, we sit on all these committees. Why is this the first time we're hearing about this? This is not just about communication, but it is about a system of care that is not a system, in my way of thinking. Maybe because I'm very linear and very anal, and I want what someone in Bennington County has. If I need it in Addison County, I want it. And I should be able to have access to it because there are a lot of similarities. We built a designated mental health system for a reason. And like I said, I'm very passionate about this, and I can go on and on and on. And so when I look at the role of the Federation, there is so much more that we could be doing to help families upstream so that they do not end up in the emergency room. One of those things, in our opinion, which I didn't cover in this testimony because I didn't intend to go here, so feel free to stop me anytime. We're trying so hard to move things upstream because the worst thing that we can do for children is not address and de-escalate before they have to have their parents take them to the emergency room. Right. There is no benefit in that for anyone, in our opinion. And so everyone receives de-escalation strategy training in the service provider system, except for families. So we do our best to educate families, but not every family who is impacted by children's mental health gets something in the mail that says Federation of Families has been around for 32 years. Go call them. They'll help you with de-escalation strategies, or BFN or NAMI or lots of places. Thankfully, the pandemic has provided an opportunity because schools really understand that they need to address that social emotional learning and to help early on. We've built in Vermont a great parent network, a parent-child network. We are working, it's, looking forward to the day when it all clicks. We've done a lot of great stuff. To us, the best thing that Vermont did in 1988 was creating Act 264, the Coordinated Services Plan process, available and eligibility for parents who are raising a child with a severe emotional disturbance to have access to a parent representative that could help them prepare to come to a community-based team table, which is called the local interagency team, for those who might not be familiar. That is, I always called it the three-legged stool. Alice Maynard, retired from the Department of Health, would tell you that when she helped craft this, it was a four-legged stool that involved child welfare, education, the Department of Mental Health, and the family. And over the years, that has not worked out that way. If you ask anyone in the federal government why they fund statewide family networks for children's mental health, the reason is that families impacted by children's mental health are the one disability category that is most often impacted by child welfare, that parents still are blamed for their child's behavior,
right,
and are at risk. And once you get involved, it's a vicious cycle for families. And they are trying to learn about what, we often very flippantly call it, is it ODD or a bad hair day? It's, children's mental health is an evolution. We don't know what goes on in those 6 hours at school. If they have a bad day at school, as families, we don't blame the school in the beginning. But anytime a child has a bad day at school, the first thing is a call. What's going on in your home? So trying to work on that, that's a huge, we've been at this 32 years. It has not been perfected. And so, but the Coordinated Services Plan, we have this vision that if all schools were using a Coordinated Services Plan, if all communities were having local interagency team meetings the same way, every county right now has full autonomy to handle it any way they want. And that is not, to us, a system.
that's right.
And so we're often looked at and we don't mean to be, we're advocating for families. It's not that we're adversarial, but it's, if you have something in place, we want to communicate this statewide. But if it looks different in Chittenden County than it looks in Bennington County or up in the Northeast Kingdom, then it will never be communicated or work the way we want. So there are opportunities. There also is no money. And as we all know, sadly, no matter how generous and how big our hearts, it's very hard to maintain a volunteer staff when you are working on something this huge. So I've strayed a lot away from the bill. The one thing, Senator Hooker asked a question about language. And at the very end of my written testimony, I asked that the committee look at the definition of certification. Peers are non-clinical peers,
Right.
and we do not give license to provide mental health and substance use disorder treatment. Treatment is language we reserve for the provider communities. So we recommend that the committee take a look at this definition and perhaps amend it. And the other thing that I wanted to, I hope you'll look at the Federation in this 32-page document, because it really does talk about the competencies. I was part of that process. As I said, I still have PTSD as a result of it, because we spent, as a national group, a whole week just talking about what to call peer support specialists. In this, there were 180 names suggested. Parent support provider, they're known as so many things in all different populations. I also had the opportunity, thanks to the Department of Health again, to go to Connecticut, go to New Hampshire and be trained when Vermont wanted to bring recovery coaching to Vermont. And very similar. It was difficult for me because I did not have my own life experience in recovery. I experienced the recovery, the treatment and recovery movement through my concern. I showed up at the wrong meeting is truly what happened, because I was concerned about the adolescent in my care who was not my biological child. But I was concerned about the messaging that we send to children about taking their medication. What happens when they become adolescents and run into substances of other kind? You know, how does that translate for children who often have expressive and receptive language challenges? You know, what is that? So, as I said, I showed up at the wrong meeting, got drawn into the adolescent substance abuse treatment revamping, and got to go as and be trained as a train the trainer to bring recovery coaching back to Vermont. And one of the things that in the substance use movement they had that we did not have in the children's mental health movement was the Vermont Recovery Network. So a place where when people were trained, they were actually going to practice their training and have it be a career path. And so last year, 2021, you'll see in the written testimony that Vermont Association of Mental Health and Addiction Recovery also engaged in a peer credentialing process. And it is not, you know, and as you can see, you know, that that credentialing is reciprocal in 27 states. When we look at children's mental health, that's too what we want, you know, some kind of reciprocity. You know, in an ideal world, you know, we would have a peer workforce that if they left Vermont and worked in New Hampshire and moved to New Hampshire, then they could pick that up, because this is peer workforce development. This is more than just credentialing. So I think I will stop there. Because like I said, I could go on this all day until
well, you know, this has been
so
terrific. Thank you. It's been absolutely terrific. And I just want to share with you that the reason that S197 is sitting here with us is exactly the reasons that you expressed. I started looking at all the programs in our local municipalities, in our counties, around the state, our DAs, our SSAs, our recovery center, all the work that's going on with a lack of connection and continuity. And so for us in this committee, our concern is absolutely continuity of coordinated care. And that's what you've been talking about. You've been bringing your systems thinking to us, and we very much value that. the trick is how to put it all together and how to first identify what's out there. I mean, you really, you know, hit the nail on the head with that. And then so that Senator Hardy's constituents have the same opportunities in Addison County, where you are, that Senator Hooker or has in Rutland County, or Senator Cummings in Washington County, and then Chittenden County, where I am. So it's all very, right now it feels like this uncoordinated system, yet some of the people who are embedded in it, like you, may have a better feeling for what's out there. So anyway, thank you. Your testimony is terrific. And you made one recommendation for language, but as you're thinking through, it would be helpful to have more thought, if you have more thoughts on how to improve any one or more of the bills. And as I said earlier, I am working with the chair of the Education Committee on these issues, because your identification of education is so critical. It seems like the pandemic has really brought out all the problems, the systems issues, and hopefully we can get a start on some of this. You know, everybody looks for the silver bullet, but I don't know if you have that. We would love to see it.
If I had this silver bullet and a crystal ball, I would not be sitting here today, because it would be working. And it's interesting. What I have found is interesting. I spent 10 years as board chair for the Federation. So I don't come to the work. I don't come to the work newly. And, you know, the majority of my time has been spent in kinship care, you know, looking at kinship care outside the foster care system through the probate court system, which is a whole nother thing. And my personal position has always been that when we remove a child from their home, no matter how well it's done, that is their first adverse childhood experience.
Yes.
And it's not just for the child, it's for the whole extended family. And so, you know, and we have talked about at the Federation, you know, we have a mission that says we serve children ages 0 to 22. What we know about trauma now is retained, you know, from, you know, in utero. And, you know, I directed the Rapid Intervention Prenatal and Parenting Project for homeless, pregnant, newly engaged in medication-assisted treatment women in Chittenden County for 6 years, identifying those barriers, because we have funding barriers other than, you know, for us as peer support, but for families who have specific needs. And that mom who cannot work because she has 2 children, one at Baird, one at somewhere else, who did nothing to cause them trauma, but, you know, has they are both on the spectrum, you know, and or have not. So, you know, there are so many levels of this, and everyone is working so hard that the most encouraging thing that I think I have seen in the 2 years that I've been sitting here is our new commissioner at the Department of Mental Health and deputy commissioner. I have great confidence that they're going to move things forward. When I look at the Agency of Education, I have a lot I'd love to say about the Agency of Education, but the positive thing is that their deputy secretary comes to that position with a background in mental health and understands that mental health truly does exist. It's not caused solely by poor parenting or not eating enough kale during pregnancy. And so there's great hope, as, you know, my 70th birthday looms, you know, and I've been around a long time, that there's been a lot of work, and it's where COVID has done us a great favor.
Yeah.
And money's coming in that we have not had before, and opportunities. I had a call from a reporter yesterday, and I said, you know, I don't want to be quoted saying this, but I do wonder is the increase in children's mental health issues attributable to any, does it exist, or is it just an increased awareness that any one of us at any given time, our daily routines change, our life changes, or whatever, that our, we go from optimal mental health to crappy mental health in 0 to 100. And so taking the time to also look at that, what is it that children have missed in developmental stages during the pandemic? I have 4 grandchildren. I have my own thoughts about that, and none of them are engaged in mental health services, but they've been impacted. Their mother is a clinician. She has some very strong thoughts about that too. So we're all working on this, and we all have great hope. As far as creating, as you can tell, I'm pretty transparent. And the Federation, no matter where this bill goes, we are still going to look to the National Federation of Families, Children's Mental Health as our credentialing body, because they have the expertise.
So this is helpful. You absolutely have identified some tension between the certification that would be in the bill going forward and the certification program that you have worked so hard to put in place. And that's a discussion we're going to have. My other question for you is, are you familiar with the National Council of Behavioral Health certification? Slightly different?
Slightly different.
Yeah.
And I think it's,
go ahead.
And I think all of these things require deeper, deeper exploration.
Evaluation. Yeah.
And how Vermont is also one of those interesting states, in that the other thing that when I participated in the National Federation of Families, most of those colleagues in similar positions to mine were already in states that were doing Medicaid billing. Our family organizations have been built out of the grassroots. We have been serving from the grassroots for decades, and it's a different approach.
And the question is the grassroots approach, the volunteer approach, the right way to go, taking steps forward? Our whole state is built on a system of volunteers. When you look at local government, and some of us believe that in the state government, in the legislature, but so as you're thinking through, if you have suggestions that would help clarify, some of the certification issues that you're talking about, and there may be a place for each of the different types of certification, because they are distinct. They are totally distinct in what can be accomplished, and one's maybe short term, one's a longer term, one's intervention, one's prevention. We're not talking treatment necessarily here, so those are all important considerations. I want to let the committee members have an opportunity to ask questions, so let's do that now. Go ahead, Senator Hardy.
Thank you, Senator Lyons. And thank you, Sandy, for your testimony and for your love of Addison County. And I'm with you. So let's see what we can do together if you have ideas. I'm just looking at the National Family Peer Specialist Certification website as we were talking. As you were talking, I was kind of scrolling through to see. It seemed, so that's specific to family peer specialists, not necessarily peer-to-peer adult peer. Okay. So there's, as Senator Lyons just said, there's, lots of distinctions within there. But what I heard from Ms. Emerson is that you were suggesting adding more specific language to family peer specialists within S195. And that's what it sounds like you're saying as well. But since there's already this program that you and many others work so hard to create, I really hate reinventing wheels. So if we could just maybe for that specific subset of peer specialists say, this is the program you should do. Is that what you're suggesting?
On later this week, is today Friday, later today, we're talking about what family to family would look like, because initially I would have said I'd like to see it taken out of there altogether. It's going to be enough to create one in the adult world. There are at least 13 peer serving organizations in the state of Vermont, most of them focused on adults and very different. So I probably, but I don't want to derail anything because I'm so excited that this is moving forward. So I appreciate, the time of those who sponsored and the thought that's being given to this piece of workforce development, but recognizing that family to family can be the adult population, but it can also be the multi-generational between the parent, child, and perhaps the grandparent caregiver, so it also looks different. And so we're going to actually discuss that more among us, because I'm not 100% familiar with all that NAMI has to offer, nor they with us, nor us with VFN or anyone else. So I think,
well, great. If you're meeting this afternoon, I guess I would just reiterate, maybe if you can get a specific language that your groups all agree on that you would like, because we don't want to derail anything or hold anything up, but we also want to make sure it's done right and we don't spend resources recreating something that already exists. So it would be really helpful to really specific language that you would like. So thank you.
And the reason that I mentioned what VAMHAR is doing is when we looked, VAMHAR was originally for 30 years, the Vermont Association of Mental Health. There was a reason why they expanded their mission and their acronym to include addiction recovery. So this bill also crosses, we used to call them silos. We don't call them that anymore, but two very different sides of the hall in mental health and substance use, and the bridge was the co-occurring. And now we're in Vermont, everything we're talking about from the state level down is about integrated care. And so, and how to integrate this. And sitting in this, we've served on 2 of those grants as the peer voice, and it hasn't been much fun because we have been very marginalized in that process. And
well, we don't want to do that to you. We do not want to marginalize you.
Right. And so when I look at substance use in this bill, I hope this committee will also be talking to, the fact that they have put in this level of credentialing and trained. And in the emergency rooms, they have, one of the things that I noticed in the conversations was for children's mental health, it might be difficult to get risk-averse institutions to allow peers into the emergency room. Well, we're doing it with recovery coaches. Granted, it's with the adult population, but parents are adults and they are providing care to their children. So we are, there isn't anything about being risk averse. So maybe, I think there's things that we can draw out of that side of the coin too, so that everybody is bringing in, what their peers. So
listen, I think we need to ask if there are other questions. I think Senator Hooker, you might have had a question, but I do want to say that we will be looking, we will have substance use bills in our hands. So we'll come back to some of the things you're talking about, but Senator Hooker, go ahead.
Thank you, Madam Chair. I would just hope that in your deliberations about including this type of certification, that you would talk to the people who have put forth these ideas, like Mad Freedom. I know Lori mentioned Wilda, and you know, because it seemed that Laura, you suggested that the implication was in the language, but that you wanted something more concrete as far as differentiating these types of certifications. And so if the language suggests it, but doesn't focus on what your needs are, we certainly want to make sure that that they're included. But talking with Wilda from Mad Freedom might be essential to know which way we should go.
She will be part of our
We do have a meeting this
afternoon.
afternoon.
Terrific. Wow, that's terrific. Whatever you can settle outside of this environment and bring back to us would be just absolutely terrific. Yeah, because we'll be looking at the bills and talking about markup. We don't have all the information that we need right now. You're obviously bringing some of it to us, and we'll be bringing other of it after conversations with the folks in education. So there's a lot here. I mean, we have a lot of work to do, and best outcome would be that we move upstream a little bit, and then understand what it means to intervene. I think because right now it's so focused on the emergency departments and all the crisis. We talk about crisis, and so we need to start talking about solving things. Anyway, any other questions for Lori or Sandy? This has been great, and we really appreciate your time, your expertise, and we wish you well at your meeting this afternoon. And if you can bring us some language that helps clarify, we would welcome it. We can't
Thank you
promise
so
anything,
much.
but we can welcome it. We'll do what we can do. All right. So good. This is great. We're actually, I think at this point, we're going to take a little break, committee, and then we're going to come back and just for some discussion with Katie. So let's take an 8-minute break, please, and come back at 11.